All right, hello everyone. So this is going to be a quick little quiz review of the os coxa. So this is a bigger bone than some of the other ones, so it actually might be a little bit longer of a video, but feel free to speed it up if you want to go a little faster. And I already drew on some of the landmarks to try to save a little time. So let's just get right into it. Grab a piece of paper and pen so you can write out your answers. Pause if you need to. And hopefully this will be a good review. All right, so your first question is going to be, is this a left or a right os coxa? So you should be able to tell just from this picture, just from this view. There's some pretty good identifying features that you can see here to be able to tell if this is a right or a left. Right, and once we go over some of those landmarks, we'll go ahead over it as well. All right, so number 2 is going to be this one. And number 3. Four will be up here. And number 5. So remember, you can go ahead and pause if you need to write down any of your answers, to think anything over. Number 6 down here, it's going to be a line right there. Number 7, it's going to be that open space in there. Right, so it's not technically a portion of the bone, but that empty space. And number 8. All right, go ahead again, pause if you need to, and we're going to go ahead over them. So let's go over a couple landmarks before we identify right and left, because I think that'll help us out a bit. So I'm going to go a little out of order, actually. So I'm going to start with number 8. So number 8 is going to be the pubic symphysis. I'm also going to abbreviate on here, but you do need to know the entire name of the landmark and bone, so make sure that you practice writing that out completely, but just to save a little time here. So pubic symphysis is going to be number 8. So that's that piece of cartilage that's going to connect the two os coxa so that they can, articulate. All right. Right, so those are going to keep those joined so that our two hip bones stay connected. Right, so that's a good way to tell that you're looking at the anterior view of the os coxa, because that has to be anterior, because that's going to be that front portion of our hips that connects together directly. Now that you know that, so a couple of them we didn't actually mark on here, but this structure, where I put that X, you know that, we're going to go over it later, but you know that that has to be lateral. And then this structure here, another X, that one is going to be having to face medial. All right, so knowing those two identifying features, if you were to kind of take the bone out of the screen, turn it around and put it on you, it would have to be your right os coxa, because that's going to be where, 8, knowing that that's anterior, your other os coxa would have to be, on your other side. So it would have to, once you turn it around, it would make sense to be on your right side, because if you had put it on your left, that pubic symphysis would be facing laterally. That wouldn't make any sense. So it has to face medially towards the midline. And another good way to remember is number 4 is your iliac crest. When you put your hands on your hips, that's what you're putting your hands on, is that iliac crest. And so that has to be kind of lateral, because kind of tilting out, sort of say, because that's where we put our hands when we're putting them on the outside of our hips, right? Now let's go back over some of the other ones. So now that we know that we're looking at the anterior view, we know that number 2 is the anterior superior iliac spine, and number 3 is the anterior inferior iliac spine. All right, and number 5, that's going to be the tubercle of the iliac crest. Number 6 is going to be the pectineal line. And number 7 is going to be the obturator foramen. Go ahead and circle that up there. All right, so now we're going to move on to another view. All right, so what number did we end with there? We ended with 8. Okay. All right, let's start here. It's going to be number 9. So I mentioned that structure earlier in that last view. It's going to have to face laterally. And so the next question isn't going to be a landmark, but I'm going to ask what bone and landmark of that bone does number 9 articulate with? So what bone is going into number 9 where I just drew that X? All right. Number 11 is going to be below that. So number 12. Number 13. Oops. So for number 13 and a couple of the others with the arrows, imagine if you were to hook your finger around that space, right? So it's that whole space around if that arrow were to go onto the other side. Same idea for number 14. And number 15, just above that. And lastly for this view, number 16. All right, so let's go over these ones now. So number 9 is going to be the acetabulum. All right, and the acetabulum is going to articulate with, go over to number 10, the femur, specifically the head of the femur. So obviously the bone would be the femur and the landmark would be the head. All right, so the head of the femur is going to fit right into that acetabulum, and that's where that articulation is going to take place. All right. All right, number 11 is going to be the ischial body, or the body of the ischium. Number 12 is going to be the ischial tuberosity. So that's going to be the bone you sit on. 13 is going to be the ramus of the ischium. 14 is going to be the inferior ramus of the pubis. Right, and a good way before I move on to identify where the ischium ends and where the pubis starts. On this picture, you can kind of see a little change in coloration on the bone, and that's kind of where that line, visible line, is formed. All right, so that side is going to be the ischium, that side is going to be the pubis. You can see those arrows there. Oops. All right, so that's how you're going to know where that division is. All right, so moving on, number 15 is going to be the body of the pubis, or the pubic body, and 16 is going to be the superior ramus of the pubis. Right, so for all those rami, it's kind of imagine hooking your finger around that structure. All right, and let's move on. So number 17. It's going to be that whole space there, where that pink is. Right there. Number 18 I'm going to jump down real quick to number 19. Going to be where that purple is. '20. 21. Almost done. Doing great. Number 22. Number 23. And number 24. All right, so let's go over these and then we'll have one more view, just a couple more landmarks, and then we'll be all done. All right, so number 17. It's going to be the iliac fossa. Number 18 is going to be the iliac tuberosity. And I jumped down to number 19 because just below that is going to be the auricular surface. And coming back up, number 20 is going to be the posterior superior iliac spine. Number 21 is going to be the posterior inferior iliac spine. Number 22, so I'm running out of room a bit, is going to be the greater sciatic notch. '23 is going to be the spine of the ischium. And 24 is going to be the lesser sciatic notch. So just a couple notes about that. A good way to identify which side is anterior and which side is posterior, I look for the greater sciatic notch because it's a pretty defining feature and it's going to be on the more posterior side. So that's how you can kind of tell where that above that is going to be the posterior, superior, and inferior iliac spines. And so hopefully you know that we're looking at the medial view of the os coxa. A good way to tell is looking for that iliac fossa. Remember, that's that bowl that creates that bowl shape, and that's going to help hold our organs and give us that hip shape. So that's a good feature to look for when you're thinking about if you're looking for the iliac or the medial or lateral side. So good way to tell that this is medial. All right, on to our last view, just a couple more. All right, almost done. This is going to be number 25. And number 26. And number 27. All right, so go ahead and pause the video if you need to, just to wrap it up, and we'll go ahead over these. So now we're looking at the lateral portion, lateral view of the os coxa. So a good way to tell is that acetabulum is kind of pointing towards us, and that's always going to be pointing laterally because that's where the femoral head fits in, like we said earlier. All right, so another good thing to look for that, greater sciatic notch, so that you know that 25 is on the posterior end. So that's going to be the posterior gluteal line that we're looking at there for number 25. And number 26 is going to be the anterior or middle gluteal line. So anterior gluteal line or middle gluteal line are both acceptable answers. And lastly, number 27 is the inferior gluteal line. All right, so you made it. You made it through the Ask Coxa. Hopefully that wasn't too painful, and you kind of get an idea of, you know, what things you need to look back on and review some more, and what things you feel pretty good about. So if you have any questions and you want to go over it some more with somebody, feel free to hop into open lab hours. Any of the TAs would be very, very happy to help you out with reviewing this. We can quiz you, whatever you need. And just let us know if you have any questions. Hope this was helpful, and hope you have a good rest of your day.